The Evidence2Practice Ontario program is supporting the delivery of care across the province by making it easier for clinicians to access and apply best practice information and quality standards at the point of care. E2P is co-led by the Centre for Effective Practice, eHealth Centre of Excellence, and North York General Hospital, and funded by Ontario Health. Disclaimer: our goal is to support clinicians with care decisions while also optimizing clinical workflows. Please consider these supports a supplement to clinical care rather than a replacement. We deeply value the work clinicians do each and every day to provide high-quality patient care. Welcome to the E2P COPD Management Tool, your comprehensive companion for COPD screening and management within Accuro QHR EMR. In primary care, timely and effective interventions are essential to improving patient outcomes, preventing exacerbations, and reducing hospitalizations. Join us as we navigate through its features and functionality. Key features of the tool include: promote personalized, patient-centered care by supporting the selection of treatment options tailored to the individual patient's needs and evidence, streamline manual lab entry and assessment, ensure consistency and efficiency in documentation, and enhance collaboration and communication among healthcare providers involved in the patient's care. The E2P COPD tool engages a modular approach format to assist primary care providers with capturing critical information during an encounter while also supporting quality improvement initiatives where possible. The tool is divided into 3 separate forms to support the screening and diagnosis of COPD, management of COPD, and creation of the COPD action plan. The E2P COPD screening and diagnosis form was designed for patients who are suspected of having COPD or who are experiencing new or worsening respiratory symptoms. In this workflow, users can document and monitor the patient's symptoms and risk factors. For patients that are clinically suspected of having COPD, the tool provides an area for users to document whether the patient was referred for spirometry or if the patient declined the referral, followed by a section to update the diagnosis status to suspected, unconfirmed, or confirmed. The goal of this workflow was to support quality improvement initiatives and provide clinicians with a structured way to assess and document the patient's risk for COPD, ensuring that their potential for the condition is properly evaluated. The E2P COPD Management Visit Tool. At the top, there are 2 distinct dates, one indicating when the last screening form was completed, and the other showing when the visit form was last filled out. This tool includes a section for spirometry results that automatically imports values from the lab report. These values can also be manually entered and are compatible with the CDM worksheet. This means that any spirometry-related lab data entered in the COPD CDM worksheet will automatically be transferred into the E2P COPD tool. Within the assessment section, users can document subjective and objective information, record the dates investigations were ordered, and review the patient's latest vital measurements. We have created COPD-specific macros to support documentation consistency, and these can be used in any of the additional note sections. Macros function similarly to quick keys and will generate a note template that enable users to document a common task more efficiently. We have pre-designed macros for COPD management, respiratory, smoking, and heart monitoring. This form is intended to monitor the patient's progress, allowing users to efficiently update and modify the treatment plan as necessary throughout the course of care. This flowsheet is designed to be both comprehensive and efficient. While offering a logical structure that covers all key elements of best practice standards, it also allows users to retain previously documented information, add new details as necessary, and leave room for future updates. The tool also provides direct access to the necessary assessments like the COPD assessment test and MMRC dyspnea scale, so users do not need to navigate outside of the tool. The management section allows users to review immunizations, document actions taken such as whether the immunization was discussed, declined, or updated, and record whether lifestyle considerations were addressed during the conversation. The purpose of the medications section is to support the selection of the patient's individualized pharmacological treatment plan based on CTS severity, incorporates lab results such as the CAT and dyspnea score, acute exacerbation severity and frequency, and spirometry results. It also allows users the flexibility to select the medication treatment plan they have independently managed, as well as document if the patient is on oxygen therapy. In the monitoring and adherence section, clinicians can document medication adherence and response, record the chosen treatment plans, and utilize the medication reference table to review best practice medications when initiating or optimizing treatment. The last section of the tool is the referral section, where users can record whether a referral was made as well as the next visit date. At the end of the visit, users can generate a pre-designed COPD letter. By doing this, whether a few sections or all of them were completed, the tool will generate a summary note, pulling in all the information documented in the tool and copying it in the letter for users to validate and share with other members of the care team that may exist outside of the clinic. User and installation guides are available for download on the community portal. If you do not have an account, please visit this website. The change management team will be happy to support you if you require assistance with installation. Please reach out to Evidence2Practice at cep.health. Dedicated to supporting primary care clinicians, allied health professionals, and clinic staff, the eHealth Center of Excellence offer guided tool installations and technical setup and guidance on how to optimize the integration of the tools into your existing workflow. In addition, our partners at the Center for Effective Practice can offer supplementary one-on-one discussions with an academic detailer on balanced, evidence-based information on insulin therapy for type 2 diabetes and non-insulin therapy for type 2 diabetes. With E2P, clinicians can provide enhanced care for their patients, all while reducing their own workload and stress. Try our COPD management tool today, and remember, our team is here to help. Learn more or sign up at E2P.ca today.